Most of us know about losing weight and keeping it off and how hard it is. But understanding why weight loss is so difficult can help you stop beating yourself up over every little setback and, of course, help increase your chances of success. We need to forget the gimmicks and face the facts about weight loss. To do that, right here on The Nation, I'm joined by Dr. Prabhajot Singh Sidhu, consultant gastroenterologist, hepatologist, and physician. Most of us who've been here on Bernama TV or follows us here on Bernama TV knows him. He's the gastric doctor to most of us. Dr. Prabhajot, thank you very much for making your way here. Well, today we want to talk about weight loss, but to get into what weight loss is and where the technology is at this point. What seems to be the problem with weight loss in Malaysia? You know, it's a country great for food. All of us want to eat.
We are the fattest.
Yeah, we are the fattest, but we also want to stay slim. So, I mean, it's a catch-22 situation. So where are we? Where are we now?
Where are we now? Well, the first thing is to understand is that it's not always about weight loss. You should be focusing on fat loss. Weight, I mean, if you look at weight, a bodybuilder will be classified as obese. Clearly not. They have very little body fat on them. And then people get stuck on all sorts of fat diets and things, lose weight quickly and things. Everything seems to be non-sustainable. This is part of the problem. And like what you said about a diet, we love to eat and our food tastes great, but it's not good for our weight or our fat content. Cheap food is available everywhere and they are low quality. That's part of the issue we have. I always say there's nothing worth eating after 9 o'clock, really, if you think about it, unless you're cooking at home.
Right. But no, those who've gotten to this habit of intermittent fasting, they find it easy because after 7 they don't eat. But that's another subject altogether. Let's talk about non-surgical weight loss procedures. What's there now within the medical fraternity or within gastroenterology that is being used? So
non-surgical, when you talk about procedures per se, the one that's more commonly used now and gaining a lot of momentum, especially in Malaysia, are gastric balloons. And what they are is essentially a balloon that's placed in the stomach, and it does two things. One, it takes up space, obviously, and the other thing, makes you feel full. One of the ways is by affecting how the hormones work and also slowing down the movement of the stomach. So you always feel full and you don't want to
So the thing about using the balloons or going drastically for weight loss program, some people think it's stupid. Some people think it's just just too much, too fast, but it works on people. It helps with people's self-esteem. If I look good, I feel good. Most so, people like me working on TV, if you put on a few extra pounds, you start to worry. And
doesn't the camera do that?
The camera already does that. So you need to try to keep it down, just so the optics that the camera gets doesn't look too bad.
Yes.
Having said that, now, with those of us doing diets and stuff like that, we feel bad that we are spending money and doing stuff like that. And they say, why are you wasting your time doing something like that? And do people ask you about this when they come to see you?
They do, and a lot of times the problems they have is that any weight loss program they've been on either hasn't worked, or as soon as they finish it, all the weight comes back on. Now, because a lot of the things that they do is non-sustainable. I mean, if you look at the very popular Weight Watchers program, the whole world knows about this. More than 90% of the people that subscribe to it have gained back all their weight. It's non-sustainable. People try to overdo it. If you're trying to lose weight the natural way with diets and exercise, aim only for 2 or 3 kilograms a month. That's like over 20 or 25 kilograms a year. That's a lot. Try to lose 10 kilograms a month and you're asking for trouble because you will probably end up doing it in a non-sustainable way and then end up eating lots more junk food. Now, there are many ways to approach it. Now, diet and exercise is always the first. Exercise is only 30%. What you put in your mouth, 70%, is very important. It's not so much the quantity does play a part, but the quality of the food.
But therein, the devil lies within the details. So you need to take care of what you eat, which means you need to make sure your vegetables, you eat all sorts of colors. You need to find that balance, and that's a very hard thing to do. Now, I'd like to dial back a little bit and talk about some years ago. I remember men and women alike walking to the pharmacy and getting a pill. Okay, it was like a sort of a capsule. When you take it, it makes you rush to the toilet every so often. Sometimes it feels like you are incontinent.
Of course.
Yep. You want to talk a little bit about that? Well, and how successful it was or it is?
It is. I think you can lose about 5% of your body weight. But one of the risks of it is incontinence. Even if you look at the leaflet this pill that helps you get rid of the oils. It even says carry an extra pants with you when you go out. Now, why would you do that? Why would you aim to lose 5% and risk soiling yourself and having to carry a pants every time you go? And the minute you stop it, it all comes back on. That didn't really take off. There are newer medicines which are only licensed for diabetics in Malaysia, which you can lose about 10% of your body weight via 1-week injections or a pill a day, which costs as much as a Starbucks or a coffee a day, but only to diabetics. You're not diabetic, you're not allowed to have it.
So that's why I hear friends telling me, hey, I need to get on diabetic medication because it helps lose weight.
Yes.
I've got friends who want to get on medication for diabetes mellitus. And where did the literature for this come from?
No, you see, if they're talking about the simple drug as metformin, and metformin is treatment for diabetes and it helps you lose weight. But I think the things that people may or may not be talking about, there are new medicines which helps you lose weight by losing weight treating the diabetes rather than it being the side effect of the medicine. So this is actively trying to make you lose weight. But again, it's not licensed. It's only a new drug. The pill has only been available in Malaysia for maybe the last month, and it's only licensed for diabetics. So non-diabetics should not be taking this, and it's off-label, and no, I would not do it. But everything has its own share of risk and things. When you take a pill, it affects the whole body. For example, this one can cause cramping, sometimes diarrhea, risk of pancreatitis is there, though rare. They do exist. So,
but there's also other things like, when you have hunger pangs, there was or is medication to suppress the hunger pangs. Yeah. And what drug is this?
There's no. Let's forget about drugs. Stop the hunger. Just eat more fiber and more protein. You don't feel hungry. Don't.
Hence why people were also going and buying kilos of psyllium husk and downing them.
Why don't you just eat some vegetables? It's cheaper, it's more natural, it's non-processed, which is part of the problem, processed food. So it's always fiber and protein that keeps you full. The other stuff does not. So if you find that you have some chicken, you're more likely to feel full. Rice, you can eat as much as you want. You're unlikely to feel full. So my patients, I always say, vegetables, plants first, protein, then only your rice. But you don't need a pill for that.
I want to talk about intermittent fasting. All of us, want to do intermittent fasting. They say it's the be-all and end-all of keeping your weight down and also feeling good about yourself and being more clear about who you are. So there's just so many things that come around with that. But we'll get back to that. Let's look at this funny-looking contraption here, okay? So, we used to make this as kids and chuck this on other kids. I know you remember this.
And they burst.
They burst. Okay, so what am I looking at here?
Okay, okay. So what it is, it actually starts out with this. This is it's relatively new. It's a little pill connected to a tubing, which a patient swallows it. It goes down into the stomach, and this bit is connected outside to a bag of fluid, and it's inflated in the stomach into this thing over here. Now, what this is one of many different types of gastric balloons available. What this does is it fills up, takes up space in the stomach, like we were saying, slows down the movement of the stomach.
Into that camera a little bit more,
This thing. Okay, the gastric balloon, and it stays there, this particular type, for 4 months, and then this little disc over there disintegrates, it deflates, and it goes when you go to the toilet. And you can lose about 10 to 15% of your body weight just by having this in there. And this is quite nice because you only swallow a pill. No fancy procedures. There's no cutting, nothing. So literally you could walk in, have it done, half the day you're gone home.
Okay, so how is this different from, people used to go for surgeries a while ago. Tell us the difference between this and that.
Surgery essentially is, firstly, if you talk about the indication, surgery should only be used with someone with BMI of 40 and above. Of course, if 40 and above, the surgery is deemed risky, a balloon comes into play. Now, surgery is good for some people, and some people really do need it, unfortunately, but it's surgery.
So when you talk about surgery, are you referring to bariatric surgery?
Yes, I'm referring to actually cutting. So actually cutting the stomach or repositioning things. There are many different types of it. But there are some really good outcomes with surgery, but please don't forget, this is surgery done on people who are overweight, who are higher risk already, and once you cut, it's not reversible. You have made that changes. So everybody knows about diet exercise, everybody knows about surgery, but for some reason or another, everyone doesn't know about simple other measures that are available.
Right. So I'm looking at this. This is going to be ingested in some way. It's going to go down.
It is,
and it's
yes.
and it's going to be inflated. So what it does is it goes into your body. They put it in, not with water in it. Once it gets in there, they fill it in, and it fills up a space in your
Stomach.
your stomach.
Yeah.
Now, what are the advantages and disadvantages of this technology today?
Okay, so for this one specifically, it only stays there for 4 months. And then you only lose 10 to 15%. After the 4 months, it's gone. You can put another one in if you want to, and so on and so forth. The advantage is there's no need for endoscopy. You literally swallow the tablet, a couple of x-rays, and you're good to go. In comparison, there's this other balloon here, which, so I showed you, it starts out like this, and you use endoscopy, and you put it down, and via endoscopy, you inflate. Well, this is supposed to be inflated, and this can stay in there for 1 year.
Right.
It's another type of gastric balloon. The advantage of this is that this extension allows you to pull it out and increase the size of the balloon if you, for whatever reason, the balloon size, your weight loss is slowing down. Right. So you get even more weight loss, and you stay in there for a year. But the disadvantage is you have to put it in via endoscopy.
Right. So to inflate this, it has to be done by a doctor.
Yes.
After a while, you just can't like pull it out and say, "Mom, can you blow in this?"
No, you can't grab it. Yeah, you have to pull it out. Yeah.
Ma, can you please blow on this? It can't work that way. But I guess everyone is rearing to do this, especially in a day and age where you're an influencer and you want to look good all the time, so on and so forth. But for people who want to do this, I mean, there are some do's and don'ts with something like this. A lot of people think that I can put this on.
Yes.
Okay, I'm not going to eat much. Yeah. Hence, I'm going to go lose weight, so I can eat whatever I want.
No, that's not true. I mean, everything is still an adjunct. It's to help healthy living. So with this, you'll have to have guidance with a dietitian. Make sure you're eating the right food. So because you can't eat a lot, you want to make sure you get good quality food, so you don't end up being malnourished. That's very important. And then over time, these habits develop. Then once the balloons remove,
right,
the idea is that your habits remain,
right,
and you continue to lose weight, or at minimum sustain the weight loss until you want to repeat this again if you want to.
Right. So if you look at this cost-wise, okay, so saying back in the day, they say, okay, I need to go do a bariatric surgery. That would set me back, I think, and at best this is a guess, 40, 50, 60,000 then. Yeah. Well, I mean, something like this, would it be much cheaper, and are the risks fewer?
Okay, so bariatric surgery can range between 30 to 50, 60,000. It depends on where and what is done. There are lots of different types of surgery that's available, and that's a whole hour discussion itself. This will cost about 14. And that includes all the endoscopies, and that includes the medication that you may or may not need. And the advantage is there is no cutting. You see, if you've had surgery and the shape of the stomach or the esophagus has been altered, these balloons cannot go in because they may sit in the wrong position. But if you had the balloons and for whatever reason you're not happy with it or not, you can still have surgery. So this should be before any sort of surgery. Right. So cost-wise is less, but also with that, the amount of weight loss can also be less than surgery, because surgery is, of course, changing the structures in a big way.
So what you're trying to say in turn is that the results are pretty astounding or good.
The results are pretty good by itself, considering that you're making no cutting, no alteration to your insides whatsoever. You can repeat it, and if for whatever reason you change your mind, it can be removed and you're back to your normal self. Also, you can go diving in flights. Doesn't change.
Okay, so here's the other thing. A lot of people want to do this, or if there's someone who wants to do it, the next question would be, and you're a gastroenterologist.
Yes.
I've got reflux problems. I've got saying if I've got Helicobacter pylori, which is giving me other gastroenteritis problems. Can you do something like this, or must that be treated first?
That's a very good question. Because it's a foreign body in the stomach, any foreign body in the stomach can have a potential of irritating the stomach. So the guidance is that if you're on a blood thinner, let's say you've got heart disease, you're on Plavix or something, the guidance is no, this should not go in your stomach, because if it irritates...
So we're talking about clopidogrel or aspirin?
Yeah, both of them, or anything that can irritate the stomach lining. If you have bad gastritis or reflux and it's really bad, and it's still an ongoing problem, get it sorted first. because invariably this has a potential. It doesn't mean it will. It has a potential of making things worse. Why would you make things worse? Why would you have this in your stomach to feel good, but in fact, during the whole procedure, you feel bad? Just get your stomach sorted first. It's easy enough to do. And then when that's in, you will actually have a much better experience. If you got H. pylori, eradicate it first before you introduce something. It's not that it's going to cause a problem, but more of why wouldn't you solve your underlying issue before you introduce something else? It's just common sense, really. But yes, you have.
Yes. So you showed us one of two different technologies which are being used a lot now. And what's when you talk about success stories of this? Let's not talk about someone who wanted to look amazingly good and is looking svelte now. While that's an interesting story, I would like to hear a story about someone get better who was really sick and overweight and felt much better a few months down the road after doing something like this.
Well, there's you don't need to hear stories from me. You can Google it. You will hear it plenty, a lot of times. And in this modern society, type 2 diabetes is a big problem. And part of the management of diabetes, it's not just controlling your blood sugars we can do with medicines, but is to lose the weight or lose the fat.
Yeah, but it's already happening with stuff like metformin. I see friends going on something like metformin and then shrinking,
And what happens after that? Do they stay on metformin forever?
Some of them do, yes.
Which is dangerous. Metformin has its own share of side effects and risks. If you get dehydrated, you have metabolic acidosis, and all sorts of other things can happen. It is not a good idea to go on drugs that you do not actually need.
So would you say the same for cholesterol drugs?
Cholesterol drugs are different.
Statins,
in a sense. Statins are different in the fact that there's a lot of evidence to show that it protects your liver. It reduces the risk of heart disease. It doesn't just reduce cholesterol. It works as an anti-inflammatory. So the chances of inflammation and plaques breaking off, it plays a role. So it's not just cholesterol. It does a lot more. So cholesterol medicines are a little bit different. I don't like people taking unnecessary medicines, but with that one, I think there's a lot of good evidence to say it does more than just reduce your cholesterol.
Right.
But even with your cholesterol medicine, if your cholesterol is down and you stop it, it goes back up. Same with metformin. If you're on metformin, you stop it. Unless you've made some actual changes to your lifestyle, everything's going to go back.
Right.
So why take a drug you don't need and get a risk?
So going back to this balloon, so once I swallow something like this, or once this is ingested or put into my stomach, I mean, it's quite weighty in my hand. Seriously.
Yes,
And will I feel this weight in my stomach?
You will feel something is there, but no, it's not going to feel like that weight. No,
it's not going to feel like that.
No, it will not. You will feel, I feel full, and that's about it. It's not like you're going to tip over and fall down or anything. No, not at all.
So, with something like this, people get sort of, they're a bit more sensitive as to how they do things. They're a bit more aware about things. Some people put this in and they starve themselves. How do you deal with something like that?
That is very wrong. See, with everything, this is an adjunct.
So the process behind thinking would be, I put 14,000 into this or 20,000 or whatever, and I have to starve myself.
No. So the simplest way to do it is you put your 14,000 in, follow the plan, which we will give you. And the plan involves a dietitian follow-up. Particularly with this one, you have a dietitian follow-up for a whole year to advise you of what you should do, how you should eat, how you should approach food. So when the weight loss happens, it's sustained. The idea is not to starve yourself. No, that's absolutely the wrong thing to do, because then you will get really hungry. You can't stop yourself. You eat junk food. All be lost. So it's follow the guidance. This is not made up. It's all been planned ahead. So just follow the advice and you will be fine.
So once you do something like this, or once you get involved in a procedure like this, there's of course a prolonged plan that comes with it, and you have a dietitian to work with.
Yes, the dietitian and doctor will follow you up.
So I mean, once someone figures out how to do this in a hotel room, it's got to happen. Like they've done with braces and Botox and whatever else.
Yes.
What would be your advice to people going out and seeking advice or procedures of this nature?
The advice is that anything you put in something, anything you introduce, make sure it's from a trusted source. You want to know all the risks, all the benefits. You don't want someone just telling, yes, we'll put it in anybody, in any age, in any whatever medical condition, because that's wrong. I mean, you're doing this for your... Remember, as much as looking good with this, it's about your health. You're doing this for your own health. After spending 14,000, why would you go to a untrusted source and put this in? Do you want to go to some place where you know you're getting the correct information, you know you can ask questions, and it's done in a safe manner, and if, God forbid, anything was to happen, as unlikely as it may be, there are things that can be done about it. If you did it in some random hotel room and something goes wrong, what would you do? You're stuck. Even if you had a balloon and you say, oh, well, I'm going to go climb up the Himalayas. I would say, well, maybe do one thing at a time, you know?
But you know, the thing that entices people to do something like this is cost, you know. Someone would bring the cost down to a fraction of this and say, hey, I've done this before. I've done this in a hospital. I can do it here. So these are things we need to worry about. Now, when it comes to parents who have kids who are on the big side and they really want to help these kids, because when you're in school, you know how you get bullied when you look different from someone else. Now, if parents are thinking of doing something like this for a teenager, is it a safe thing to go?
I think it is, but it should not be the first thing to do. The first thing you should definitely make sure that all the avenues of the simple, as much as I put it, diet and exercise, it is actually very simple to lose weight. I've had patients lose 20 kg in 3 months just by the approach to food has been changed. That must be done properly. You do not put children or teenagers through something like this if you don't have to. This is
I'm talking about a demographic here who can afford something like this and say, you know, my son, daughter is a bit oversized. You know, I think I want to make them look good. It helps their self-esteem because, you know, I'm up there at the high echelons and wonder what kind of, you know, how condescending people can be on my children. So I want to do something like this for my children. So the advice would be to not make this the first resort.
This should not be the first, no. This can be as part of the plan, because if everything else has failed and there are the health risk and this will really reverse the health risk and things, then yes, this can be discussed. But you should always start from the pure basics. I mean, if your kids are having just processed junk food, burgers non-stop, I mean, that's pretty obvious. Address that first, you know. I mean, if they're sitting down.
So if the kid, let's give it another scenario now. If the kid has got some form of ailment in his or her body and is also, you know, I mean, appearing to be big in nature.
And you're saying in this situation the weight loss will change the life expectancy and all this
and
sort of
also
thing.
the health.
Yes, exactly. Then it's worthwhile discussing. It's no guarantee that yes, that person needs to have it. It's all individually based, because you want to be careful when you're talking about teenagers. I deal with adult medicine, so those discussions, if it's a young person, must be had with the pediatrician, and if appropriate, then refer and discuss further. It's not to say no, but it's definitely not to say yes also. It's an adjunct to help. Kids that size, if they're going to benefit their health, it is worth considering. But again, like I said, you must make sure everything else done properly. Don't introduce something if you don't have to, but if you have to, take something that is reversible, that is low risk, and you know, you can repeat it.
Right. So what's this thing about, now that we're talking about diet and losing weight and all that, I just want to get into diet teas for a while. A lot of people drink diet teas say, oh, very good, I'm going to the toilet a lot after drinking diet tea.
Sure. So it's like this, right? If I told you don't eat rice for a day or two, you would lose 1 or 2 kilograms. Why? Because rice holds water. Diet teas do the same thing. They help you lose water. There are many studies to even show that if on a day that in the morning you haven't gone to the toilet, you will weigh so much. After you've gone to the toilet, you've lost the weight. If the diet tea is just helping you lose all that weight, then yes, of course you lost weight. But is it sustainable? No. Because at the end of the day, you're going to eat and things, the weight will go up. No.
So I mean, to simply put this, diet teas don't work.
They only work for a short while and everything's come back.
Right. With that, we'd like to thank Dr. Prabjot for coming in and taking a look or giving us an idea of what weight loss is all about and what's new in the market. And if you're going out to do this, make sure you go check with a doctor. If it's a kid you want to do it on, make sure you check with a pediatrician. On that note, I'm Gerard Ratnam and Dr. Prabjot Singh signing out. This has been The Nation on Bernama TV. Thanks for staying with us.
reka bentuk sejagat tu penting sangat. Cuma orang mengambil mudah. Jadi prasarana tu penting. Pemahaman masyarakat terhadap pentingnya kita mengadakan dan menyediakan kemudahan yang mesra OKU bukan sahaja untuk OKU tetapi juga warga emas kerana 2030 Malaysia akan sampai ke negara yang tua. Jadi kita mesti lakukan segalanya dengan cepat dan bukan sahaja di kota tetapi di kawasan pedalaman. Kita cuba sedaya upaya kita.